TNT Open Mind Insights brings you powerful, authentic conversations, illuminating the path to better mental health care for all.
Well, Zane, thanks so much for joining us today.
Oh.
I'm really looking forward to learning more about you and more about your career. My understanding is that you are a nurse practitioner and you've had a fairly extensive career, broad-based. But one of the things that I noticed was your interest in serving the homeless population and those underserved. So I'm really looking forward to learning more about your career.
Great. Yeah, I started out as a psychiatric nurse and went to school for my nurse practitioner degree. Worked at a hospital for uninsured inpatient psych during that time. And then once I became a nurse practitioner, a family nurse practitioner, so I was doing internal medicine for that system.
Okay.
So the main thing I was interested in at that time was how can we integrate psychiatric care and medical care, just because we have so much specialization.
Yes.
So that's why I ended up pursuing this program.
Nice.
Yeah.
Nice. Yeah, and so interest in kind of integrating fields that are often siloed is also what I've noted in your career.
Exactly. So, if a patient gets diagnosed with a severe psychiatric disorder and does need inpatient hospitalization, a lot of times, especially if they're from the homeless population, they'll end up in the emergency room, and then not much testing's done for worse. We'll say for worse, and then they would end up inpatient. Sometimes they would have other problems that weren't diagnosed previously. Many times diabetes or hypertension, but occasionally neurolupus or neurosyphilis, things like that we needed to monitor for. So yeah, it was really gratifying to be able to to work with that population and treat them medically.
When you look at your career, what have you found to be some of the barriers to individuals who are homeless or are in areas that are underserved? What are some of the key barriers, in particular for receiving mental health and addiction services?
Yes. So access is huge. I'm currently work at Grace Light Community Clinic, and it's also for underserved FQHC. And it's largely with Salvadoran and Mexican population, Hispanic population.
Yes.
So,
and you speak Spanish as well.
I do speak Spanish. Yeah. So 70% of my patients are Spanish only.
Oh, that's phenomenal.
So yeah, it's fun. It's fun, but yeah, there's so much cultural nuance with mental health and psychiatric diagnoses. So much stigma within any community, even the homeless community.
Yes.
So approaching that is difficult, but having gone through these programs, TNT and everything, it's helped a lot. In terms of addiction medicine, I would say that was the first program I did with TNT.
Oh, very good.
And in our acute setting, we were getting so many people who had some sort of amphetamine psychosis, and they weren't being treated for addiction.
Correct. Yes.
Which was interesting. So while I was there, I helped institute that program, created some guidelines for what we could do, and I do the same thing in my outpatient clinic. Like sometimes I have people come in who are actively using amphetamines or usually that's what it is. Usually they're actively using amphetamines.
That's a real big problem across the whole nation, isn't it?
Yes.
Why do you think that individuals who clearly need the care around their methamphetamine use, why aren't they getting that care?
I think it's a lack of focus within the education system as it stands and as it is. Maybe we get one day, if we're lucky, on addiction medicine in a nurse practitioner program. And I think it's, in general, again, the stigma. A lot of people don't want to treat it. It's easier to just judge it and shove it out the door.
Yeah.
But if you actually get involved with these patients and see where they're coming from, what kind of, I guess, what kind of barriers they face
Yeah.
in life, and what barriers they face to getting help with addiction,
Yeah.
then you can make a big difference.
Absolutely. Yeah, no, absolutely. I mean, clearly you're a champion in this space, and I can see your passion. Where does that come from? How did you get interested in working with people with mental health and addiction, in particular methamphetamine use? Where does that passion and interest come from, Zane?
Where does that come from?
Yeah.
That's a good question. Without being too personal, I mean, definitely I've seen friends and family members,
Yeah.
with these kind of issues, and severe psychiatric issues. My grandfather had bipolar disorder,
Okay.
was discharged from the Navy during World War II for.
Oh, wow. Thanks for sharing that.
Yeah, but once he got medication and things have vastly improved both for the family and for him.
Excellent. Yeah.
So I think that legacy, as well as just seeing friends struggle with this kind of thing.
Yes.
Yeah, and then ending up as a psychiatric nurse and I think when I went in, I expected it to be, oh, there's going to be a lot of people with, I don't know, they're suicidal or they're have schizophrenia. I didn't anticipate the addiction piece to be such a huge part of the homeless population psychosis.
Well, and again, as you mentioned, a lot of that is the lack of education and experience that we get in our training. So we get out there, we start doing our work, and it's, oh my goodness, 75, 80% of the people that we're seeing have these real serious needs.
Absolutely. And
Yeah.
psychiatric problems, sometimes, somebody's been smoking meth every day for 10 years.
Yes.
Sometimes there'll be developmental problems. And definitely there's a lot of trauma that comes out and plays out in different personality and psychiatric ways.
You mentioned trauma.
Mhm.
And how you see trauma in a lot of the individuals that you're serving. Can you talk a little bit about that and what you see in the patient population you're serving?
Yes, definitely. I mean, it's traumatic for sure to live on the streets in Los Angeles, just to survive.
Yes.
With adult women, things we would see were sometimes incontinence related to history of sexual assault or prostitution.
Yes.
We had teenagers who were sex trafficked,
Mhm.
who were given meth and coming off of it when they came to us.
Yes.
And it's hard because
Yeah.
it's so tragic. And then you can kind of only do what you can. Part of the thing I learned in this program, I think, is that you can only do what you can do while you're with them,
Yeah.
and try to, find out their motivations.
That's
and
right.
Find out.
And see them as in that shared humanity. That's again what I'm hearing from you is oftentimes we as health professionals, kind of as a defense, will put up walls between us and that very human suffering.
Yeah,
But what I'm hearing from you, Zane, is to open ourselves cautiously to that shared humanity.
absolutely. Yeah, I think a humanist perspective within psychiatry and mental health, as well as an internal medicine or family medicine, is so important.
Absolutely.
And unfortunately, we don't have a class in listening, I guess, in school. But learning how to listen, and definitely motivational interviewing, that kind of
Yeah,
kind of
absolutely.
those tools definitely help.
Yeah.
To explore instead of just jumping to conclusion and being frustrated that the patient is not just doing what you tell them to do when it's so
Right, right,
complicated.
yeah. Well, and what humans, do what we're being told to do right
Right,
away,
right.
right? That's just not
Exactly.
humanity either.
Yeah.
So yeah, no, it when we open ourselves up and we're sharing in their suffering, we can sometimes really experience that suffering. Have you seen that in your career?
It's definitely something that I'm aware of, and yeah, it's difficult because we take on those emotions sometimes more than we intend to.
Mm-hmm.
And I think sometimes a backlash to that is to just shut down in the face of those emotions.
That's right.
So it's a difficult balance for sure. Um, I find it really gratifying for outpatient to see people come back
Yes,
and
absolutely.
um, doing better and or just trying,
Yeah,
you know.
right.
If a patient says like, "Oh yeah, I was I took the medication that you
Hmm.
prescribed. I didn't smoke, but then I relapsed and I smoked."
Yeah.
Um, yeah, that's okay. That's expected.
Absolutely.
Yeah,
Yeah, it is expected.
yeah,
When we're treating chronic illness,
exactly.
we expect to see symptoms continuing as we're working with the individual.
Yeah,
And when I have someone who comes into my office and says, "Hey, doc, I've returned to use," I often really give them kudos for being so honest and coming
absolutely. Yeah.
forward with that, because that's kind of scary, isn't it,
Oh,
to admit to your health professional that you've returned to use with something like
yeah.
meth.
We're definitely in a kind of priest role in that
Yeah.
situation until we shift it and say
Yeah.
like, I'm not here to judge you.
Yeah,
I'm
no.
here to help you achieve your goals.
That's
So.
wonderful. That's fantastic.
Yeah. So I think with outpatient, the other things to think about with family medicine when I'm seeing people is and the chronic physical effects of these kind of use as well as psychiatric antipsychotic medicine, stuff
Sure.
like
Yes.
that. In terms of obesity, diabetes, um, yeah, hypertension.
Yeah.
I mean, I had a patient a few weeks ago who came in and blood pressure was 170 systolic. I said, "What's going on?"
Yeah.
And they're, "Oh, I don't know. Every time I go to the hospital or something, they always say like your blood pressure is so high." And I said, "Okay, well, and the more we're talking about it, he's like, well, I did smoke amphetamines this morning." I'm like, "Oh,
Yeah.
okay, yeah, all right. Well, so it's not just going to be an antihypertensive that's going to fix this problem.
Yeah.
Like, we really need to focus." But sure
That's right.
enough, after over 3 months, I come back, his blood pressure is under control, and
Yes.
it's
Yeah. Well,
it's amazing.
again, you're clearly communicating to that individual. I'm here to listen.
Mhm.
I'm here to help you with what your needs are. Where so often when they're in going to really busy hospital, ED, there's not the time really to sit down.
Oh
You
no,
know what I mean?
yeah,
And just the fact that you were willing to say, what else is going on here? It's an open door. And then I also, just in talking with you, there's such a sense of non-judgmentality of accepting the individual where they're at, wherever they're at. And I think that's important too.
it's very important. I think in terms of it's not something that's always obvious in our culture, um, for whatever reason. There's a lot of black and white thinking.
Yeah.
Um, a lot of personal responsibility is important, and we can maintain that to a degree.
Yes.
Um, but yeah, trying to understand that it's a little more complicated.
Absolutely. Now you mentioned culture, and as you have talked about your career and the multilingual approach that you have to your career and care, it strikes me that you are in your work at the intersection of many different cultures, and that your work is defined by multicultural intersectionality. Can you share on that?
Definitely. In the different places that I've worked, I mean, for the large part in Los Angeles and Central Los Angeles, it's majority Hispanic population. Within the Salvadoran population, a lot of people moved during Civil War in the 80s. So generational trauma right there to carry over.
Absolutely.
And then in terms of Guatemalan, same thing. There was a long history of political violence there.
Yes.
And so those are the major populations that I serve. Some are indigenous people who don't even speak Spanish as their second language, and sometimes not even that great. And it's
Yes.
kind of hard to find a Quechua translator or whatever.
Sure.
So yeah, trying to get at the bottom of what's being said, and even generation to generation, I'll have parents bring their kids in. The kids are interested in psychiatric help and they need it.
Yes.
But the parent is very hesitant. They think that, well, one, they want like natural remedies,
Yes.
which, we usually go for therapy or something like that in terms of referral.
Yes.
But in terms of medication, if it's really needed,
Yes.
it can be difficult.
How do you navigate those sensitivities and concerns from the parent generation?
Yeah. Well, I try to recognize where they're coming from. That it's just a different system of belief. Sometimes I bring up that okay, in Japan they have integrated health system with homeopathic medicine and do a lot of research on that. Unfortunately, we don't have that here, and I'm not qualified to prescribe those things. But it's not to discount them. It's just that I'm not educated in those things. So this is what I do know. These things work, and try to just see if they're open, giving it a try.
Yes.
Talk to the adolescent by themselves too, just to see what's going on.
Yes.
But yeah, it's a dance.
Yeah.
Definitely a negotiation.
It is a dance. It is a dance. Yes. Where do you get your experience in doing that dance? Where does that come? Where does your expertise stem from in this way? Fascinated.
Where does it come from? Yeah, I think again, navigating family dynamics with severe mental illness. Personally,
Yes.
I think that the baseline tolerance for some people who have had these things normalized
Yeah.
is
right.
like you either become a nurse or not.
Yeah.
So
No, absolutely. When we're thinking about mental health, when we're thinking about addiction, so many people have been touched in a personal way, either themselves or, as you talk about, your grandfather and friends, that it becomes personal, doesn't it? And we need to reflect upon that. We need to understand that personal piece. But it serves to make it real.
yeah,
And that this isn't just a career, this isn't just a job, but you're reaching out to connect with people in their time of need.
absolutely. And yeah, I think it's important. It's not for everybody.
Not for everybody. No, that's right.
Definitely,
Yeah.
nurses. When I was starting, they'd start their first day, and at noon they go to lunch and not come back.
Is that right?
Oh yeah, because they're not used.
Yeah.
They're not used to homeless population. They're not used to people who are dealing with severe psychiatric issues.
What have you done to help your colleagues to better understand and to kind of pass on your experience, expertise, and that personal piece? How do you help your colleagues?
Well, there's a few things actually. So, after each of these programs, I went back and went over lectures on different parts for the providers and the
Living out
nurses.
that train new
Yeah,
trainers, aren't you? Yeah, I love
exactly.
that. That's great, Zane.
And yeah, and just going over the things I thought could really impact our practice. Day to day, it's just a question of trying to get people who I work with comfortable to also treat these things.
Yeah.
One of my coworkers is a nun,
Is
and
that
she's a
right?
nurse practitioner, and she's
Fantastic.
great.
Yeah.
And she brings so much, I don't know, joy,
Yeah.
love,
I
and
love it.
understanding to the table. But she's so afraid to prescribe
Interesting.
psychiatric medicines or
Yeah.
deal. Whenever she hears an addiction thing, she says, "Refer them to Zane."
Refer them to Zane. Yeah.
So, getting everybody comfortable on the team
Yes.
to be able to address these issues. We also have a book club
Do
for
you?
yeah, for it's mostly psychiatric nurses who have either worked in a psychiatric setting or previously worked in a psychiatric setting.
Yep.
Um, and we do it about once a month. And yeah, we read kind of history of psychiatry stuff. We we read a book called Mind Fixers,
Yep.
which was really interesting, biological history of psychiatry.
Yeah.
And it was so much fun to just go through and the medications and the history and the treatments and kind of come back around to like, oh, what was working in the 1890s? Like they had nice gardens.
Yeah.
They were hanging out. It was peaceful. There were people saying nice things to these patients. It was like, oh yeah, no, that's actually really important.
Yeah.
Like we should keep doing that.
Yes.
So we read that. We read Philip K. Dick's A Scanner Darkly, which is like a science fiction about a fake drug and addiction and navigating that and that system. And right now we're reading Judge Schraber's diaries.
Are you really? Oh,
Yeah.
that's fantastic.
So just to talk through that. So
Yeah. It sounds like that also serves as connection with your colleagues.
100%.
Yeah,
And
which is critically important. We haven't really captured that importance of human connection, but we certainly see that in our therapeutic interventions with patients. That if we can make a genuine therapeutic connection with them, treatment goes much better. But that connection is important in our own lives and our careers as well, isn't it?
definitely. And on the side of the nurses, it's and talking through that. I mean, one of the things we talked about in Scanner Darkly a lot was that this undercover police officer has taken on um, basically a second identity in order to navigate what he's doing with addiction, and has become an addict himself. And a lot of it's like, how do you balance having these like deep emotional conversations, taking on these things with patients 12 hours a day
That's right.
with life, and then come home and your spouse who doesn't do that
Right.
like
No, that's
but
right.
has their own problems and has their own stressors.
Yes.
Like how do you come back and be someone else?
Yes. Yes. What has that meant for you? How do you manage
Well,
that transition?
well, it's meant 2 divorces. No. How do I manage it? I think exercise, pets, and definitely the camaraderie and friendship of other nurses and doctors.
Yes. Yes. What do you think is at stake if we don't move forward in helping more of our healthcare system see individuals who are homeless, who have generational trauma, severe mental illness, and addiction? What's at stake if the healthcare system doesn't respond to those individuals?
Well, right now we see this crisis in Los Angeles in terms of 70,000, 80,000 unhoused people.
Yes.
and many of them with severe mental illness or addiction issues, and then those things get in the way of housing because there's this feeling of not being heard, not autonomy not being respected.
Yes.
I know there's a giant hotel in downtown Los Angeles that was set aside for homeless housing, but largely remains empty because people said, well, they wouldn't let me take drugs in there.
Right,
You know,
right,
and, like,
yeah.
that's pretty important to me
Yeah.
day to day.
Yes.
So I think rethinking the model in terms of um, getting people towards their goals psychiatrically and
Their goals in particular. I just want to,
exactly.
right?
Yeah,
Not our goals.
exactly.
Yeah. Yeah.
Okay.
Okay. Yeah. What with all that we've been talking about, what gives you hope in this moment?
In this moment, I think there's more awareness of psychiatric needs and addiction within homeless population and just population in general, low income population. Everywhere, I think our understanding of it has shifted dramatically over the last 20 years, definitely.
Yeah, agree.
And there's a lot more evidence-based um, treatment and that we can engage in. Programs like this give me hope because
Yeah, well, and I can say right back at you, people like you and careers that really are the bright lights out there, that's what gives me hope, is seeing how individuals who take the TNT trainings, go back and in their communities and in their places of work, really are beacons of light and hope. And I just want to share that with you today. I've really enjoyed getting to know you, to learn more about you as a person and as a colleague. Thank you so much for taking the time to share who you are and how you shine that light to people who often don't have much other light. If you could, leave the listening audience with one or two kind of key takeaways or pearls, what would those be today? What do you want people to know?
I think the main thing is learn to listen. You think you know how to listen, but you don't.
Very
It
good.
takes a lot of practice and to be able to really hear what somebody's saying and incorporate that into whatever your plan is going to be.
Yes.
Yeah, we have 7 minutes with a patient, but it's enough time if you can really get to the core of it. And building those relationships and building that trust, not only with your patients, but also with your colleagues is very important to have those resources because it's difficult work. And, but there's going to be change.
So, if other people are like me, really interested in what you're doing and what you've got going on, how might they be able to connect with you via social media or something else?
Well, I'm on LinkedIn. You can definitely send me an invite if you want to have a conversation about what we're talking about. And I'd love to talk more to people who are interested.
Yeah, well, I've enjoyed listening to you and hearing and learning more about you. And just want to, again, thank you for taking the time to talk and share who you are, what you do, and again, the light that you shine in your career. Thank you very much.
Oh, thank you.
Really
Thank you for
appreciate
having
it.
me. It's so great.